Hi everyone, my name is Shelby Reed and I will be presenting on COPD in horses. So COPD, also referred to as HEAVS, is a respiratory issue. COPD stands for chronic obstructive pulmonary disease, and it's some of the most common issues with horses, and there are various ways to diagnose, but it can be a long process. So what is COPD? In COPD, less air flows in and out of the airways because one or more of the following things are happening. Either the airways and air sacs lose their elastic quality, the walls between many of the air sacs are destroyed, the walls of the airways become thick and inflamed. The airways make more mucus than usual, which can clog them. All of these things cause it to be harder for the horse to breathe. So here is just a picture of what the airways look like when they are constricted and when a horse has COPD. So the normal airway, as you can see, has a large opening for air to flow in and out, and the one on the right is inflamed and constricted and usually has some mucus in it, so it's harder for air to go in and out and the horse has to force it. So some diagnostic tools to use to diagnose a horse with COPD or HEAVS are medical history, which can sometimes be hard to get for some horses whose records may not be 100% accurate or kept up very well. There's also a physical exam you can perform. Respiratory rates and pattern can be measured, and there's aseptic procedure as well. So one of the diagnostic tools, a physical exam, the first thing you'll want to observe is the horse's attitude. You want to check with the owner or the caretaker to see if anything has been off lately with their attitude. Next, check their overall body composition. See if there are any abnormalities. As you can see here in the picture, when they breathe heavy in and out, it causes a lot of strain around the ribs. So you can see kind of an indent below the horse's ribs in the back there. With heavy breathing, there's a lot of energy it's also being exerted, so you might be able to tell that just by looking at the horse. They'll have a lot of weight loss because they can't keep up with eating enough to keep up with their maintenance requirements. Also, their stance can give you some indication. Their hair coat, if it's dull and rough looking. And also the capillary refill, which is where you pull the skin out and then release it and see how long it takes before it's back to normal. This should only take 2 seconds or less. So more of the physical exam. You can also check the mucus color. It should be like a pink, like slimy texture, and if it's dark or blue, that usually means that there's a problem. And it shouldn't be cloudy. You may notice the horse coughing or wheezing a lot, so you just want to keep track of how many times they might do that in an hour or so. You can listen to lung sounds, and that should be able to tell you if you should be able to hear if there's something in the lungs or in the airway, like mucus. And then also inflammation or redness in the sinuses, which this can be discussed later and done through an aseptic technique. So it is important to check respiratory rates and patterns as well. Nostril flaring is common in COPD horses because they're trying to intake more air. Often they will be exhibiting extra abdominal effort, and you can also see that just by looking at them. Their respiratory rate normally should be anywhere from 10 to 24 breaths per minute, depending on the horse. So anything above that or above what's normal for that horse might indicate a respiratory issue. So the aseptic procedure is used to check for inflammation and swelling, and that's when they put a camera up into the sinuses after lidocaine has been administered into the tissues. The pictures here just show the paths to get to the different sinuses so that they can take tissue samples and with the camera check to see how inflamed or red the area may be. So a study was done by Roy and others in 2003 to test exercise-induced bronchodilation versus the effects of this powder, ipratropium bromide, which is used with asthma patients. And they found exercise to be more effective for short-term relief of COPD than the powder was. So what causes COPD? The type and quality of hay and maybe some other feeds they might be allergic to, weather, stress, because it compromises the immune system. Bedding, maybe it's too dusty or might have some mold or allergens. And also the environment, ventilation, you don't want it to be dusty or cloudy and they're breathing in kind of a dusty, dirty air. You want to make sure there's a lot of airflow, and cleanliness of the barn overall. So prevention, storing hay away from barns where horses are kept could help, and maybe just even storing it in a different location of the barn, like the end of the barn in a separate room. Proper ventilation, you always want to make sure that the fresh air is flowing throughout. You want to minimize the dust in the feed and in the bedding. Maybe you can minimize the dust in the feed by adding some kind of oil or molasses to kind of bring down the dust. Manage the stress properly based on your horse so the immune system is not compromised and the risk for COPD does not increase. So in conclusion, through physical exams, one can catch the early signs of respiratory issues and stop disease from occurring. Exercise-induced bronchodilation had a greater effect than the powder ipratropium bromide that's commonly used in asthma patients. And with proper management, COPD can be prevented. Thanks for your attention.